James with Love My Pups, My Breeder Supply. I get a lot of calls about infertility problems, and I did a previous video on stud dogs. Now we're going to do one on females, and why you may not be getting a litter, what the causes are, what the treatments could be. So let's start talking about the major reasons. Okay, so first off is failure to copulate. The dogs aren't getting hooked up, or they're not getting hooked up long enough. It may be a cause of the female, it may be a cause of the male. In females, it may be some females only like particular dogs. They're aggressive towards other dogs. Some dogs are, especially dogs that are raised in the home, not around other dogs, may be very scared by a male dog and may not want to breed, period. The male dog may not know what's going on. He may be young, he may be shy, he may be too insistent, but those could be problems that cause dogs not to hook up in the first place. So the fix for this one is relatively straightforward. You just do an artificial insemination. So I've got videos on exactly that, quite a few of them. But basically you just collect from the dog, use an AI rod or do a surgical or transcervical insemination, and you take the place of doing the actual connection. That's your job. So that's a fairly easy thing to fix. So the second one is irregular cycles. Irregular cycles. So typically you expect a dog to come into heat every 6 months, regardless of whether it's been bred or not. Typically it's every 6 months, but it can vary. Some dogs it's a year. Some dogs it might be as much as a year and a half. Some dogs it might be as short as 4 months. Some dogs it might be very varied. What I tend to see is, especially in young and older dogs, these irregular cycles. You know, young dogs that are sub a year old, they may have a heat cycle at 8 months and they may come back in 3 or 4 months later. And you may not get the dog successfully bred on that cycle, and it'll smooth out and get better. So the first advice that we always say is don't breed a dog until it's at least a year old, and preferably its second heat cycle. You want these to smooth out. You're not going to do any harm by this. I would not breed a very small young dog. That definitely could get you in some trouble. I've never seen this happen, by the way, where we've got in trouble with this, but I don't think I've ever bred a dog that's basically a year old or older. All right, so irregular heat cycles. And dogs that aren't coming into heat at all, we'll talk about that here a little bit. There are medicines that you can give to bring a dog in. Not something that I necessarily recommend, but we'll talk about that in a bit. The third one is the dog gets pregnant but absorbs the puppies. So you've done a test. You can do a test for pregnancy at 30 days, either a blood test using a relaxin test. We sell that product. It's pretty inexpensive. You do have to draw blood, but you can get results in 5 minutes. More expensive route to go is to go get an ultrasound done, and you can visually see what's going on. You know, with the relaxin blood test, of course, you don't know how many puppies are there. All you can say is the dog appears to be pregnant. It's pretty reliable. It's not 100%. You can get false positive and false negatives, but not very much. With an ultrasound, you know, if you can visualize basically some dark areas in the uterus, then the chances are the dog's pregnant. But what can happen is the pregnancy starts off okay, and then the puppies get absorbed. So we'll talk about that here in a moment. Number 4 is that never gets pregnant in the first place. Just fails to get pregnant. Everything seems fine, the dog goes through a normal heat, you do progesterone testing, you breed the dog, 30 days later, nothing there. Well, so what are the reasons for this? Well, typically it's a timing issue. You've got your timing wrong. But there can be a number of factors here that could be going on. So you could have the timing's wrong. The window of opportunity to breed a dog successfully is about 1 day either side of optimum. So there's about a 3-day window. If you get too early or too late, you'll have small litters or no puppies at all. So this is a typical situation here, is wrong timing. And so how do you time this? Well, the best way to do this is to do progesterone tests. Anything else can be based on blood color, behavior of the dog, number of days in heat, vaginal cytology. They are all valid ways of doing it, but they are certainly not as reliable as doing progesterone tests. And by the way, on this front here, not only should you do a progesterone test to determine when's the right time to AI, but what I like to do is to do 2 AIs 2 days apart and then do another progesterone test at the back end of this to make sure the numbers have stayed elevated and are increasing. Because you can get a dog whose progesterone levels look fine and then all of a sudden it dips back down. And you're breeding here thinking that you're up here somewhere and you're not, and that is the problem. So those dogs can still be successfully bred. They just need to be bred again when the timing's a bit better. What do I do with my rag? Rag, that sucks. Got to pause it and get a rag in a moment. All right. Number 5 would be that they do have puppies, but they lose the pups immediately or directly before or after birth. You could have stillborn puppies born. You can have puppies that are born and then don't survive. For a few days later, the puppies are dead. Those ones there, the things to look for on this are underlying medical problems like canine herpes virus. Canine herpes virus, you'll typically have puppies, but they won't survive. That is one that you can do a test for. You do a titer test. A dog that has canine herpes virus typically can infect other dogs in your kennel. If it's had a litter that's failed because of canine herpes virus, it will probably be okay in the future because of the antibodies that have been developed. But this is a sexually transmitted disease. You don't want any part of it. I've never had it personally, but it's something you want to watch out for. Brucellosis is another sexually transmitted disease that will absolutely wipe out puppies. Typically they won't even be born or they'll be born dead, maybe reabsorbed. Brucellosis is something you can't fix. Once you've got brucellosis, it's there. There's a simple blood test for this. We sell that on our website. You just have to draw blood. It's not very expensive. I recommend that every time that you bring a new dog into your fold, especially if it's not a puppy but an older dog, you test it for brucellosis. And we test all of our males every 6 months for brucellosis. We've never had it, never want it. Any dog that comes to our facility to be bred gets a brucellosis test, otherwise it doesn't come on the property. We want to make darn sure that brucellosis is not present. Sexually transmitted disease, it's infectious. If you get it in your kennel, you likely give it to all your dogs, and then you start having problems. So you absolutely want to check out for that one. So that's the brucellosis. So the ones we talked about was CH, canine herpes, herpes, canine herpes, and the brucellosis. Brucellosis. You want to. This one here is something that, look, it's not very common, but certainly you want to catch it. If you've got a problem with it, you want to catch it before you infect all your dogs. Let's now talk about, so we talked basically about failure to connect, how you'd fix that by doing an AI, irregular heat cycles in young and older dogs. So let's talk a little bit about what you might be able to do if you've got a dog that just is not coming into heat. So the 2 things that I know to do is, one is to house with dogs in heat. This works magically. In fact, people who have a few dogs may find that all their dogs start cycling at the same time, which presents its own set of problems because we just had a litter, 2 litters that were 5 days apart. That puts a big load on us, so we don't like that, but I guess we don't have any choice if we're gonna house our dogs. They're in their house, they're running around, one dog comes in heat, it brings other dogs in. So that's one thing that you can do if you've got a dog that's just not coming in heat and you've got somebody who's got another dog that's in heat, whether it's even a different breed, see if you can borrow that dog for a little bit. That might help. The second thing is there's a product called PG600. And this is actually used in pigs. It's actually to bring pigs into gestation. I've never used it. I have bought some and put it in my fridge in preparation because I had a dog that I thought was never going to come into heat. About the time that I was ready to use it, bingo, the dog came in heat. I had another friend who then came and got that from me and used it on their dog somewhat successfully. So what this is it's an injection that you give, and by the way, if you can buy this at Allied Vet, and you'll see a lot of people commenting about it, and all the people who are commenting about it are all French Bulldog people who've used it successfully. I personally don't like this idea. I think when you start messing around with nature, you're stepping in there and taking a risk that you're going to mess the dog up in terms of future heats. The heat may not be a very good heat. You might have, a funny litter. I'm not saying don't use it. I mean, I would not use this unless the dog has been like a year past the point that you think it should have come in heat and you're about to give up on the dog. And I wouldn't give it to a dog that you, well, I just be a little careful. Look, if it works so well, we'd all be using it. I'd know about it, I'd be using it. I mean, there's some advantages to having puppies at particular times of the year, Christmas being an example of it. If this works so well, everybody would be plugging in with PG600 and using the crap out of it, and we're not doing that, so that tells you something right away. So I'm just not a huge fan of this, but that's not to say that if it's a last ditch attempt that you shouldn't be using it. Okay. All right, so that's talked about the failure. So we talked about failure to connect, now we talked about irregular heat cycles, and that's what that is about. Okay, so puppies that are getting absorbed. So we did talk about things like brucellosis and canine herpes virus. And by the way, if you've got brucellosis present, I think you're done with that dog. That dog's not being bred anymore. And that's time to spay it. And then you've got to be careful with that dog because it could continue to infect other dogs. If you've got canine herpes virus, there are things that you can do that you know that you've got canine herpes virus. You're about to have a litter. Get yourself an incubator. Get those puppies in the incubator at a temperature of 105 degrees, pretty warm. It apparently stops the virus from growing, and it can really help the situation. So an incubator and a hot temperature is the only way that I know of that you're going to fix CHV1. It's a virus. You can't give anything to it. There's nothing you can do about it. If you've got it, you've got it. You just have to manage it. Okay. And so another thing that can happen is lack of, never gets pregnant. No, this is absorbed puppies. So the next one is progesterone levels. So you can get into a situation where a dog's progesterone level does not stay high enough. If you look at progesterone on a dog that was at heat here is day 1 and gave birth around day 60, be about day 70 approximately from first heat. What you're going to see is a slow rise and then a rapid rise of progesterone, then stays up high and then drops down right about 6 days prior to 4 days prior to whelp. It drops. So you've got this level here that we're breeding on, and we're breeding around a 15. And we want to see this level above a 20 for the entire pregnancy until we get to the point we're close to whelp. If this thing is getting down through here somewhere, that is going to probably cause you to lose puppies. And what you can do is you can give products to raise and keep progesterone levels high. In fact, I literally 5 minutes before this video had a conversation with a friend of mine who's a vet, who does use our dogs to breed with, who did have a problem. So I'm going to tell you about that because it's pretty interesting. So what happened was, she didn't know that the progesterone level was low, but she knew that her dog had got a problem because it produced a stillborn puppy. So it produced a dead puppy, and that was caused, we don't know why the puppy died. By the way, she ended up with a successful litter. She had actually 5 puppies that were born, 5 puppies inside her, of which 3 survived this whole thing. But it was pretty tenuous. So what happened was, she had a puppy that was born dead. And that was like 6 days prior to whelp. And she was very worried about this dog going into labor because of this. Full labor. So we had a conversation about it, and I started talking about progesterone levels, and I suggested that she did a progesterone test, which she did, and she found the level was lower than 6, and that was still 6 days to go. And that is a level that is likely to start causing premature birth. So she gave a product called Regumate. It's actually used, I think, in horses, Regumate. She gave Regumate every day. She tested progesterone level and gave a small amount of Regumate, and she staved off the whelp for another 4 days. So she was still about 2 days early by our calculations, but her level then was like a 0.2, and she went into labor. She did a C-section. She had 3 healthy puppies. Actually, she had 4 puppies. 1 was dead, and 3 were alive. And so she stayed this whole thing off, was successful with a litter of 3 beautiful puppies that she really should have had none. So the point here is that if you think you've got a problem going on, or if you've had a dog that's had a history of showing that it's pregnant and then not having any puppies, I would highly recommend that you start checking progesterone levels, probably at like day 2 weeks after you've done your first AI, and you've had a problem dog in the past, do a progesterone test to make sure the levels are staying up, because you can do something about that. Someone's calling me, we'll call them back. Okay. So the one thing I haven't talked about now, so now we're talking about, now we're going to talk about never gets pregnant. So what are the reasons why a dog just flat doesn't get pregnant at all? So the most common thing is timing. You inseminated the dog too early or too late. That'll muck it up. I mean, if you get small litters, there could be other underlying problems, but likely it's timing. Semen quality. If semen is being shipped to you, then do they know how to ship it? Do they have a dog that hasn't been used too much? Because that's another thing that can happen, especially with popular dogs. They get used too much, their semen count goes down. So semen quality is critical. If you don't have good quality semen, you're not getting a dog pregnant, or you're going to get small litters. Technique. I see this one a lot, actually with vets. People that you think would know, where, you know, here's the problem. You go to the vet's office, they're very busy. It's your turn up, you take your dog back there, they do the insemination, they give you the dog back, it's 5 minutes later, and the dog starts leaking semen out its vulva. So all the stuff that you put in, 90% of it comes out. Look at my video on techniques. The dog needs to be held up with its butt in the air for a good solid 30 minutes. If you go to the vet, they give you your dog back and it's just been a few minutes, take your dog and hold its butt up like this. Sit in the car with its head between your legs and its butt up in the air, and get a thumb ready if anything starts leaking out to at least pinch the vulva shut or stick a finger in there. Got to get the semen to stay inside the dog, because if you don't, you've just done the Roman Catholic method of not having puppies. So yeah, so technique. And then the last part about this whole video is going to be about underlying medical conditions, because this is another cause for everything. So what can be the underlying causes? Well, the first question that I ask of anybody is, has this dog had puppies before? Because if it has, there's probably nothing wrong with the dog. If it hasn't, and you've done 2 or 3 goes and not had any puppies, definitely it's time to investigate potential medical problems with the dog. So what are they? Well, the first one is hypothyroidism. Hypothyroidism is low thyroid, and low thyroid can cause all kinds of problems with the endocrine system. So this is something that a blood test, a simple basic blood test that costs you 50 to 80 bucks, can give you a good idea if there's some underlying problem. And there's ways you can treat this. You can give synthetic thyroid medications to bring the thyroid level up. So that's one thing. So the next one would be this low progesterone that we talked about. And so you know, if you've got a dog that's apparently not getting pregnant, I would check its progesterone level a week afterwards to make sure the progesterone levels are staying up high. Number 3 would be a subclinical infection. Subclinical infection, particularly the uterus, infection of the uterus. So with these dogs, you can give antibiotics at inception time to quell any bacteria that might be in the uterus. So, you know, some of these dogs, maybe it's time to pre-treat with something, with an antibiotic prior to doing, you know, a week before, and on your vets, you know, get with your vet on this. But maybe some antibiotics are in order. We talked about brucellosis, and we talked about CHV, so we're not going to talk about, we're just going to write them down here. Brucellosis and CHV, those have got to be, you know, if you've got those problems, they've got to be tackled. Number 5 would be an abnormal ovulation system, abnormal ovarian system. And so what are the things that you could do to detect that? Well, I think probably to have an ultrasound done, look for cysts, look for cancers. Those are things that could be cause of the problem. And I mean, if you've got those, then you're going to have to do some surgery, or you just, you know, not going to breed the dog. There we go. God, that's a long one. I think I've covered everything that I can think of. Let's see here. yeah, that's it. Thanks for watching. Be good to your doggies. Bye, everybody. Thanks for watching the video. I really appreciate people who subscribe to me. It helps me, encourage me to do more of these videos. But do remember, disclaimer here, I am not a vet. I'm not a licensed medical professional. I'm purely a person who's been breeding dogs for the last couple of decades. Any information that you got from this video, use at your own risk. There's nothing implied here, and certainly this should not be used as a substitute for advice from your veterinarian or your medical professional. I hope you enjoyed the video. Come back for more of them. Bye.